All right, go ahead.
Hi, good afternoon. Welcome to this edition of PAF Pep Talks. PAF stands for Professional Athletes Foundation, and this year the foundation is celebrating its 30th anniversary. Our commitment to former NFL players through financial assistance, social work programs, and our Living Heart Foundation health screenings has really been the pillar of our success over the past 30 years. Um, 2020, what an interesting year. This has really shown to be a time where former NFL players, more than ever, probably need to tune in and focus a little bit on their health. With the absence of our in-person screenings, and we had a fantastic year last year going to Chicago, San Francisco, Kansas City, and Orlando. But then our last screening was this year, just prior to the pandemic really taking shape in this country. We did a fantastic screening in Anaheim, California. And that's been it. So we've really lost a little bit of contact with our former players. So today's show is just an attempt to reconnect players to their health. But before we get into the doctors and Dr. Roberts has been gracious enough to compile an esteemed group of medical professionals from around the country, and some have even worked internationally. But before I get to Dr. Roberts, I want to bring in former NFL player Greg Camarillo that played 7 seasons in the NFL, mostly with Miami, but there were a couple of years there with Minnesota and New Orleans. And Greg had gone through one of our screenings back in 2017 in Arizona, and they were just really starting to really grow and take shape and move in lots of different directions back in 2017. But I wanted to check in with Greg. He was not far removed from the league in 2017. So I just want to check in with him and see if he can recall what that experience was like, that first experience was like for him going through the Living Heart Foundation screening.
Yeah, well, thank you for having me, Andre. It was at the Former Players Conference, and I was there to, be part of that conference, be around football players, have a good time, get a little vacation from my children as well. And, you offered these screenings, and I figured I'm here, it's free, why not go for it? So it was really my first experience getting a lot of those tests. As a football player, I've always had team doctors. And then once I stopped playing football, I had to figure out what regular non-players do. And I didn't know how to find a primary care physician. I didn't know how to get these tests, things that I would never even consider. So it was a great opportunity to take care of my health and get to meet with experts.
Now, Greg, you're one of my favorite former players, and you're a family man, and your spouse has been with us, at some of our events. When you went to that first screening, what was her reaction? Did she have to nudge you, or were you kind of thinking, hey, I need to go do this?
She nudged me so she could go hang out by the pool and spend a few hours without me. But no, it was why not take advantage of it? She was on board. And it's just, you guys made it really easy. I didn't have to jump through any hoops to get these tests, to see these doctors. And so it was an easy decision. You guys laid it out for me, and all I had to do was show up.
Now, over the years, some of the former players have complained that, they're getting all of these, health services, but their wives haven't been included. And they're saying, hey, I don't want to live to 100 without my wife. So what can the PAF do about that? So last year we did add for the wives to be able to come and go through these screenings as well. And we did our first wife screening at the Jersey Shore Medical Center with Dr. Masterson and Dr. Roberts back in 2017. So, sorry, 2018. So that was nice to be able to add that to our program. But Greg, so you just recently had a follow-up with Dr. Roberts, but that initial screening in 2017 for you, did it turn any lights on for yourself? Did it, you're a former professional athlete, you're a world-class athlete. We all think, hey, we play pro sports, we're healthy, we're gonna go on like this forever. Did it turn any lights on for you to say, hey, I need to pay attention to a few things?
Yeah, turned a big light on for me. So, you go through all the tests, and one of them is, oh gosh, I'm gonna mess this up. The doctors are here for me. a scan of the heart? Is it a sonogram or some vision of the heart where you're getting to see and measure the size of your heart valves and walls? Sorry, doctors, if I destroyed that right there. But
You destroyed it.
one
Don't
of
worry about it.
one of my heart valve walls was thicker than others and on the edge of what is considered normal. And I panicked. I'm like, oh my goodness, I've got an enlarged heart. You always hear of people just suddenly dying from something like that. And it stressed me out. But speaking with Dr. Roberts and getting a chance to actually communicate with an expert, he basically told me, don't worry about it. It is totally fine. You are within the normal realm. So if this had happened without access to an expert, I would have been stressed. I would have been freaking out. But because I was able to speak to Dr. Roberts, I know it's not a big deal. I'm totally fine. And also just for myself, I know that's something I can keep an eye on down the road.
Yeah, thanks for sharing that. And that problem's not uncommon for former players, as I've learned, working with Dr. Roberts and, the process of deconditioning, after such an intense athletic career. So you had a follow up with Dr. Roberts a few days ago. How are you doing now?
Doing well. I'm more relaxed. Yeah, it's nice to get those follow-ups. A lot of times you do a test and it comes out fine, or there's a red flag and you don't do anything about it because it's hard to get in contact with a regular physician. You don't know who to contact. But through the PAF, we've got the experts right here for us, and it's easy to get in contact with them and get some expert advice.
Yeah, thanks, Greg. I appreciate your time with us. Thank you very much. So now I'm going to bring in Brig Owens and just talk a little bit about Brig. Now, this is our 30th anniversary, and Dr. Roberts can attest, launching a program through the NFLPA or the NFL, it's not an easy terrain to navigate. Lots of lawyers, lots of people involved, and it has to almost be perfect in order for something like this to even lift off the ground. But back in the early days, 2004, 2005, when Dr. Roberts was really trying to push his program, he came to me at the NFLPA's Professional Athletes Foundation and really needed some funding for this to go further. And he needed the former NFL players as well. So Brig Owens was serving on the board at that time when Dr. Roberts made his pitch, and happy to say that it passed with flying colors. But Brig, can you just shed a little light on the history of how this began? You've been a huge supporter of this program and really have promoted this program to former players over the years. So thanks for being with us, Brig Owens.
Thank you, Andre. It's good to see you, especially during this time. But I think with the Players Association, what you've done with regards to this screening program and Archie has done to make it grow, it's so very, very important, because what happened, what I found out when I was playing, also when I found out when I was at the Players Association, I know after every season, I would always go get my own physical because I didn't trust the team doctor. Because I wanted to know if there was something wrong with me, I wanted to know. And Chris Hamburg and I did the very first commercials for Holiday Spa. It became Bally's, now it's LA Fitness. And we had lifetime memberships. We still get membership notices, but we used to go and get a complete massage after our games. The very next day after a game, complete body massage. And Dr. Hausen used to give us this fresh juice extractor that he brought in from Germany. This was in 66, 67. So there were no such thing as a juice extractor in this country. And to this day, I still have a juice extractor. So does Chris. But we would go to practice the following day, and we'd be nice and loose and so forth. And guys used to say, "Aren't you guys sore?" I said, "No, we're just in great shape." We never did tell any of our guys, our teammates. But make a long story short, Chris and I are probably two of the only guys on our team that never had to have any kind of major surgery. And we think it was due to the massages that we were getting the day after a game. But also what this opened turned on a light for me, the fact that players, when they retire, they still think they can use their team doctor. There are specialists throughout the country and in their home city as well. that they need to go to. The Ys already have OBGYN and so forth and certain specialists that they can go to. We as athletes, we're so focused in on the team doctor because they do everything for us. But I think there needs to be some kind of program put together to have to give the guys some guidance in terms of where they can go to various specialists. Because once you get out of this game, things start to happen to your body, and it's gradual, and sometimes it's sudden. And I'm now at the age of 77, and I'm looking around, and a lot of my teammates are disappearing for various reasons. And I find myself getting phone calls from players wives, wanting to know if I could give them some guidance in terms of where they can go for medical help. And Andre, I've called you a couple of times with regard to players needing the help. And I think that we need to put something together like that. Maybe we can do it based on chapters. But one of the things we do as players is that we kind of isolate ourselves from time to time, and we're out of touch. So what I do is, I've been a former player and one of the captains of the Redskins, is I tend to call my teammates to see how they're doing. And, they seem to really like the idea because no one's contacted them. You're sort of divorced from the game and your teammates, because a lot of the guys go back to their own small towns and they vegetate. The next thing you read about them in the paper.
Yeah. So Brig, you bring up an interesting point, and you talk about isolation. So, the way that the Living Heart Foundation program is built out, we go from chapter city to chapter city and hold these heart screenings where players have an opportunity to come and all be together. So, the health screening, as important as the health screening is, the camaraderie is just as important, and players sharing with one another and us players realizing that we're not in perfect health. It really is a motivator for us to do better in that space. And the Living Heart Foundation has really been, before anyone else really cared about former NFL players, before anyone else really cared, it was two guys. It was Dr. Kevin Guskowitz down at the University of North Carolina with the Center for the Study of Retired Athletes, and Dr. Roberts with the Living Heart Foundation. So they're on our Mount Rushmore at the NFLPA for service to former NFL players. Well, thanks, Brig, but I'm gonna move on to Dr. Roberts now. So I'd like to introduce Dr. Roberts, and he'll introduce the other doctors. But for me, it's been so much fun to get to know Dr. Roberts over the years. And, I know he talks about this a little bit more now than he did in the past, but we do have lots of players on the call that don't know this. But Dr. Roberts actually finished 6th in the Heisman balloting when he was a senior quarterback at Columbia University. So what is it that this guy can't do? So without further ado, I'll turn it over to Dr. Roberts.
Well, I paid Andre to say that. From my point of view, it's all been a good experience. Briefly, it happened that at the end of my medical career, I was a heart surgeon, and I'd done thousands of open heart surgeries, but I myself had a little stroke, and I thought I was in good shape, and I thought I was fine. I had a endarterectomy of my carotid artery, and that straightened things out. But I decided at that time that I had enough of cardiac surgery and the rigors of the operating room and emergencies. So I said, I think I can help out by working with NFL players. And I went through the process initially with the idea of health screenings, education, seminars, testing, and it wasn't easy. And it was not until Andre and the NFLPA stepped forward and said, I think this guy has enough of a good thing. Let's give it a whirl. And without that platform, we wouldn't have had a start. So I owe the NFLPA a gratitude, and Andre has been a good friend through all these years, and we're not dead yet. We're going to continue, and we have to revise things some and change the method of how we move forward. But I think Andre and I have good ideas, and Brig has such a knowledge of the players that we can all figure out a good way forward. Having said that, let me introduce the man sitting with me, Dr. Ray Masterson. His specialty has been internal medicine, and he's been part of the screening team for over a year now. Ray, what do you think of what you've experienced?
Actually, it's been very nice. It's been in practice for 40 years. It's nice to travel around and see the former players and their wives. I've never been disappointed by any of the questions or any of the players I've met. It's been wonderful, and you always find out new stuff all the time, as you gentlemen know. And it's nice to be able to pass on fresh and current information that may not be out there available to the players or even the regular public at this point.
Thanks, Ray. Dr. Herman, you're up there with us? Yes. Dr. Herman is from the Sanford Clinic, which is out in Sioux Falls, South Dakota. A place I've never been, but boy, I'm eager to get out there and see how you've developed such a nutrition and dietary plan. So many of our players can benefit from what you do, and you not only do it in Sioux Falls, but you do it in other facilities all around the country. So the ability to get coaching and weight management and wellness principles will be very important. Would you say a few words?
Yeah. So sunny Sioux Falls, South Dakota. It's quite the destination this time of year. So if you want to come visit, we'll make it work. But yeah, I work for Sanford Health. It's a health system with about 45 hospitals. We have about 50,000 employees. So quite big up here in the middle of nowhere. But then I came on board to work with their health coaching company that was a bit of a startup. And we've grown. Right now, we have over 160 health coaching centers across the country. And we coach virtually or on video in all 50 states and a couple of countries today. So excited to answer questions and make sure people are focused, just like Greg said, focus on their own health, focus on themselves at this time. And so just glad to be a resource.
Well, thank you. Thank you. We've talked, you've heard from Doctors Castellani and Perry earlier. Are there any other remarks you'd like to make before we go to the players and their questions?
I think, Rudy, you should comment about CTE.
May or may not come up. I don't know. If the group's not aware, I'm a neuropathologist. I've studied I've seen every form of neurodegenerative disease imaginable, every form of traumatic brain injury imaginable. I've seen hundreds of athlete brains and military service member brains. I've studied them, and I have a very evidence-based approach to this problem that I'm happy to discuss. But it's a very very serious issue, and I take it very seriously. So, and also I guess I should mention I don't have any affiliation with any sport organization. That sometimes gets asked, and I guess that's all. I guess that's all I would say. I just would say also if the question that came up earlier about if you're if you're going to live to be 100, you want your spouse there. One cure for that would be to become a neuropathologist, because then your spouse might leave you and you wouldn't have to have that problem anymore.
We get that one. All right. Is there anyone else on the faculty? I think Dave Gergen. Is Dave here? Oh, he's just waving in the background. Dave has been most helpful with sleep apnea, and he has been with us for years. He's in.
Here, Paul, get out of the chair. Jesus.
Give us a little of what you do for the players, Dave.
Okay, is this on, Palmer?
Yes.
Hi, we go ahead and we take their impressions and their bites. We position their mandible, this is the mandible, in a forward position so that they can get oxygen even at night when they're sleeping, and it keeps the airway open so it doesn't close. And this is actually prevents sleep apnea from taking place. And sleep apnea causes so many problems: obesity, heart disease, strokes, seizures, all kinds of stuff. And we've been working with Dr. Roberts and Andre Collins since 2012, actually a little before that, 2010. And we've had really good success. And Andre's been an incredible leader, and he's done so much for the guys and for Dr. Roberts. Dr. Roberts has done so much for the guys. And I'm just grateful to be a part of this program. We've just come out with a brand new test unit. Palmer, can you hand me one? And I'm going to show it to you guys for the first time. So this is the new home sleep test unit right here. And it clips onto the finger, Dr. Roberts and Andre. And it gives us, Dr. Roberts is going to love this, it gives us 10 nights of study. So after we deliver the device, now we can get follow-up and see where our guys are doing. And we can have, like you talked about, Dr. Roberts, serious medical data. And it'll tell us right where we're at. And we've done it on now about 8 guys, and the results are incredible. So the program that you guys started is working outstanding. I'm just happy to be a part of it. Thank you.
Well, thanks, Dave. Is there any other faculty on the line?
I think that's it, Dr. Roberts. I guess we can move on to Dr. Kim.
Dr. Kim, okay. Dr. Kim is, I've talked about him before. He's from Emory in Atlanta, and he's worked with us in the past. He's going to show some slides related to the coronavirus. Dr. Kim?
Thanks so much, Archie, and it's a real honor to be back here with you. Let me just pull up my slides here. So as Archie mentioned, yes, I've had a chance to work with Living Hearts before in the past. Just to give you, everyone who have not met in the past before, a little bit of background. I'm in charge of the sports cardiology division here at Emory University School of Medicine. I also work, very fortunate, honored to work with many of the teams in town, and also a member of the American College of Cardiology's Sports and Exercise Council. And Archie asked me to talk a little bit about COVID-19. I'm going to talk about the association between COVID-19 and the athletic heart, about the heart in general. And then at the end, I'll talk a little bit about one of my research passions, which is very relevant to this audience as it relates to cardiovascular issues in football players. And I'll just touch on that at the end. I have about 10 minutes, so I'll move pretty quickly. Here are my disclosures. Again, I have research funding through the NIH and one of the local recreational clubs. I do have relationships with many of the teams in town here in Atlanta, as well as Georgia Tech. So I have really just 4 primary objectives. The review with everyone. And again, this is about to talk about the effects of COVID-19 on the heart. There's going to be a slant to the athlete, but while the audience here are retired NFL players, I'm aware that many are still very active and engaged in high amounts of physical activity. So I think it's still relevant. But again, we'll also talk about the general population as well. Just touch on a little bit about some of the controversies that many people are aware of as it relates to return to play for athletes in the setting of COVID, and some of the important things that we really need to learn to move forward in terms of understanding this novel disease. And as you'll hear, there's much we still don't know. So March 11th, 2020, we all have certain events where we always remember where we were. And I think when COVID-19 became very real for most of us, certainly us in the sports world, this was the day. I was watching TV with my wife, and up flashed the fact that the Utah Jazz at the Oklahoma Thunder game was canceled because one of the players for the Jazz tested positive for COVID-19. Interestingly enough, that was also the night that Tom Hanks tested positive, and that was made aware on the news. But soon thereafter, the next several days, we had the cancellation of March Madness. The Masters was canceled. Obviously, spring training stopped. And again, the sports world shut down. Now, at the time, we were still learning quite a bit about the virus. This is a very busy slide, and it's meant to be that way. We're not going to go through this slide, but the reason why I show this is the one thing that we know is coronavirus, SARS coronavirus 2, does have an association with injury to the heart. Through multiple mechanisms, we're still trying to understand all of these different mechanisms, but nonetheless, particularly for patients who are admitted to the hospital, so again, these are quite ill patients, there is a tendency to observe cardiac injury. So if we were to summarize what we do know, again, for those patients who are hospitalized in the hospital, cardiac injury is common. Upwards of 20% of patients will show some degree of cardiac injury. And to put it in some perspective, that's much higher than if you had a patient admitted with a severe other respiratory viral illness. The degree of cardiac injury just is extremely common for COVID. And what we've learned is that COVID is really a multi-system disease. So it doesn't just affect the lungs, it affects the heart as well as the blood vessels. And for those who develop cardiac injury, outcomes are worse. And what we know are that older patients, and really those patients with underlying pre-existing conditions, which do include many cardiovascular risk factors, outcomes are worse. What we don't know are what about the majority of patients out there who don't have severe COVID, a mildly ill patient. We know many patients can be asymptomatic, but those who maybe just have a little bit of URI symptoms or a headache, they don't need to be hospitalized. Is there any sense of or degree of cardiac injury there? We still don't really know that. But early on, this was in May 2020, because of what we were seeing among hospitalized patients in the sports cardiology world, we were quite concerned about athletes coming back. So we put forth some recommendations of cardiac testing for athletes who develop even just minimal symptoms because of what we were seeing among hospitalized patients. Now, again, this was a document not meant to guide public health policy. This was really meant for athletes in return to play. And it also wasn't meant for just somebody who wants to get back to regular exercise. But it was important to note at the time that we were all in a national lockdown. Nobody was doing anything. So these were clearly purely just opinion-based recommendations. Well, the national lockdown lifted. Since that time, most athletes have come back to at least training. Of course, we know of many sports, professional sports, that have come back. There have been some higher profile case reports of athletes that have disclosed that they've had evidence of heart injury. Of course, there's been the controversy. We're aware of the Big Ten. Of course, they're now back to action, but there was the question of when they were coming back versus the other college football conferences. And some of the controversy was actually based on some studies that were published at the time. Now, these were the couple studies that really drove some of the concern. And it's important to note that there are limitations with these studies. These were studies focused on small populations of athletes. The second, the study at the bottom here by colleagues from Ohio State, were solely focused on college athletes. And in both these studies, with the use of cardiac MRI, they were showing that potentially there was evidence of cardiac injury in either patients or athletes who had minimal to no symptoms of COVID-19. Now, before everybody gets even more concerned than what on top of the concern that these studies generated, it's important to note that there were clear limitations with both of these studies. No control population, again, limited data sets, and really we don't understand the clinical significance for what these studies showed. So moving forward, actually hot off the press, we actually recently published a study. This came out on Monday, updating our thoughts as it relates to COVID-19 and athletes specifically. And really, I think we made a couple important conclusions based off of where we're at as of October 2020. Number one, we clearly recognize that there's actually still a lot that we don't know. We still don't know the prevalence of cardiac injury in those patients, whether you're an athlete or not, who is asymptomatic with COVID-19 or who only has mild symptoms of COVID-19. But what we've learned from athletes coming back, myself as well as many of my colleagues who put together this document, we've seen athletes who are returning to play. We've screened them with extensive cardiac testing, and we're not observing actually a lot of cardiac injury. So we're recommending actually that most athletes or patients in general who only have mild to no symptoms can get back to exercise without cardiac testing. They don't need extensive testing, just focusing in on the slow return to play. It's those who develop more significant symptoms for which perhaps there needs to be at least an assessment by a physician. The use of cardiac MRI still remains an active question in terms of how that plays into screening for return to play. We feel quite strongly though, and it's important to note that all of these issues that you're hearing about related to the heart and COVID should not be the reason that we don't play sports. It still remains a public health issue, and I will defer to my public health colleagues as it relates to the safety of sport participation, as it relates to active community transmission at the time. But it shouldn't be based solely on all of these questions related to the heart. For patients who are not competitive athletes but engage in high levels of activity who become infected with COVID-19, it's important to note that the majority of these individuals can resume exercise once they get better. So you got to do your CDC self-isolation, got to make sure the symptoms have gotten better. And you can probably get back to exercise slowly. Just make sure that you don't notice any new symptoms. For those who are older or who have underlying cardiovascular risk factors, these are the patients who you at least want to touch base with your primary care doc and make the decision about the safety of getting back to higher levels of exercise. But that's a very reassuring thing to make clear, that we don't think at this time that across the board, everybody needs to have all these cardiac tests before they want to get back to training if they've had a bout of COVID-19, certainly if you've had a mild case. I want to just touch on, this is just the only slide, and again, Archie is very well aware of this, but one of my primary passions in research has been studying early cardiovascular risk in football players. And I've collaborated with Georgia Tech as well as Furman University in Greenville, South Carolina, in a registry that we've developed really since 2014. And we published a lot of studies. I'm not going to go through each and every one of these. This was the most recent. And the one take-home point from this slide is just to note that we have shown that particularly for those younger football players who develop higher blood pressures, who are gaining substantial amounts of weight, there is a development of some early maladaptive changes in how the heart and blood vessels look and interact with one another. Now, again, this is all subclinical. And rather than the discussion of brain injury, it's important to note that these data to me highlight really the most important fact, which is that my hope is that all players who are engaged in elite football participation just understand that it's really important once you complete your career, or really even during your career, to focus on heart health. Check, make sure that you know what your blood pressure is. Obviously, many athletes, particularly if you're on the line, we understand that you have to carry on large amounts of weight. It's a part of the game. But once your career is over, it's really important to transition away from that and think about developing excellent heart healthy habits. We do know that particularly in retired athletes, heart disease, not brain disease, heart disease is the #1 killer for football players as they get older, earlier in life. So it's really important to pay attention to this, the garden variety, good heart healthy habits with diet and exercise. And this is, again, an area that we continue to remain highly interested in, and we'll continue to publish data as it relates to how best we can promote the health of the football players that we care for. So to summarize, when we talk about COVID-19, it's the hospitalized patients, it's those who carry cardiac or really just essentially any pre-existing condition who are at higher risk for both cardiac injury as well as poor outcomes. We still don't quite understand how much of this is going on with those who are not as sick. As it relates to athletes, again, we don't know what the risks are as it relates to cardiac injury for those who are asymptomatic or who only have mild symptoms. Current observational data are limited. We're in the process of working with I'm working with colleagues of mine across the country, developing a registry of collegiate athletes with the professional teams that I work with, and again, working together, putting together a registry of professional athletes as well who have had COVID-19 to answer some of these important questions. Thus, for now, we still maintain a very cautious approach. We probably don't need to screen and test all athletes who have had COVID-19, probably more so the ones that have more significant symptoms. And again, let public health lead the way. The heart's an important part of this, but that should not be the reason that we make decisions about whether or not sports should go on. Here's my Twitter address for those who want to pay, again, kind of keep up to date with some of the research that we publish, specifically as it relates to cardiovascular health and football players. Please follow me, and I'll stop there. Thank you so much.
Great. Thank you, Dr. Kim. So as we move into the questions, I guess my first question is for you. I haven't had a chance to read the paper, but this is important to former NFL players and some of the players on the call. I mean, we all believe we're growing little future pro players in our backyard like little tomatoes. But so what are your recommendations for their return to play? Are we risking their potential pro future by letting them engage right now during the pandemic?
Andre, that's a great question. I think there's two answers to that. Again, number one, as it relates to just playing sports, I think it goes along the lines of community transmission. You got to listen to the public health experts. They're the ones that are telling us what is safe, what's not safe to do. If the public health folks in your geographic arena are saying thumbs up, it's okay, then I would be fine with letting certainly my children play as well. Now, as it relates to the heart issues, we actually touched on that in our last consensus document, at least within the high school realm. I actually train internal medicine pediatrics, but I'm focused solely on adult cardiology now. But I still see patients at least around 15 years up in terms of athletes. And again, what we're seeing are the majority of these individuals presenting with either no symptoms or minimal symptoms. And with some of the screenings that we were previously doing, we weren't finding really much of anything. So, of course, again, if you're older and you have more symptoms, and what do I mean by more significant symptoms? Persistent fevers, systemic symptoms, chills, diffuse muscle aches, severe lethargy or severe fatigue, obviously cardiac symptoms, chest tightness, shortness of breath. Those are the symptoms for, at the least, you want to touch base with your general pediatrician before getting back to decide if there's a need for any testing, and then certainly to emphasize a very slow and gradual return to play. I would say for the majority of younger athletes in high school or even younger, more often than not, they're going to be able to get back to sport without really anything, just again, ensuring that there's a slow return. There is one other condition for young individuals. It's this thing that we call multisystem inflammatory syndrome in children, or MISC. I suspect many of you have seen coverage of this on the news. It's a rare condition, but it is a very significant condition that can actually develop up to around 4 weeks after the initial infection. And again, there's association with COVID-19. So if you're 21 years or younger, that's an additional entity to watch for. Again, there's no test to screen for it. It's really more just looking for potential symptoms that could be consistent with that condition.
Okay, great. Thank you, Dr. Kim. Okay, so moving on. This is a question from our audience. What type of exercise at minimum is recommended during the pandemic? We've all been kind of shut in at home. So what exercise at minimum is recommended? And I guess that could be either Dr. Kim or perhaps Dr. Herman can answer that.
I can comment, but maybe Dr. Herman, if you want to go first, go for it.
I was going to say, some of the things that we focus on with a lot of our members is making sure we can lock in a behavior of being active on a regular basis. And then, making sure you're aligning that activity or exercise level with your goals. so that you can create some sustainable habits. So it can vary by individual and what your goals are. We know that the general recommendation is trying to get out at a minimum of walking about 150 minutes a week for some health enhancing benefits. That's a recommendation for a general population. So that's a minimum that we would strive for. And then higher intensity exercise or a combination of strength training would be good. But Dr. Kim, go ahead.
Yeah, no, I'd agree wholeheartedly. Again, at a minimum, 150 minutes a week of moderate level exercise, 75 minutes of intense. But again, the bottom line is exercise is medicine. So whatever you were doing before the pandemic, you should continue to do. Now, if you're based solely in the gym, public gyms, that's where you really want to be careful. I'm in Atlanta, and I still have hesitation about the safety, the public health safety of gyms right now. So that is a consideration. But as it relates to the type of physical activity, you want to maintain those habits, both for physical and mental health.
Great, thank you. So this next question is probably, let's go to Dr. Masterson for this. How can a former player that's not overweight, lower blood pressure and reduce the need for medication?
That's a wonderful question to ask. Part of it is what we can control ourselves, and part of what we've been given to work with. If the high blood pressure runs in the family, as it does in mine from my mother and father, I picked it up. My wife's a cardiac nurse, so obviously there's a healthy diet in the house. So there's some things I know I can control, and there's some things I know I cannot control. So I'm 5'6". I've always wanted to be taller, but this is what I've been dealt with, and that's pretty much what it is. I mean, and as you get older, as Andre, the rule is if you're 50 years old, there's a 50% chance you'll have hypertension. You're 60 years old, there's a 60% you'll have hypertension. As you and I get older, the parts get a little tighter, a little tougher. And so just trying, again, as the gentleman said, to exercise, don't smoke, eat right, stay active, and pray for good genetics sometimes.
And most importantly, continue to monitor your blood pressure and stay focused on that.
Correct.
Thank you. So here's an interesting question, and I don't know if we have any sports medicine or rehab guys on the phone. So maybe this is for Dr. Kim or Dr. Masterson. Recommendations for lower back cramps while walking. This player seems to, when he's out trying to exercise, is getting some cramps in his lower back.
I'll let Dr. Kim go first, and then I'll jump in. Unless you
I was going to defer to you.
All right, that's fair enough. You're a professional athlete. You all know about stretching and warming up and maintaining your flexibility. Again, as I hate to blame everything on our birthdays, but there are things in our back that we cannot control, and maybe through a lot of physical activity and then a lot of physical contact, have the bones taken a bit of a beating, have the disc taken a bit of a beating. If it usually comes with walking, you think about either the disc starting to slide a little bit, but usually the professional athletes have excellent muscle tone in the lower spine. The other thing is that there's arthritis in the spine, which they would call like a spinal stenosis, that will grab you as you're walking. And usually the call on that one is that you'll walk 100 feet, and the vascular doctors will tell you, well, try to walk 110 feet. But if it's spinal stenosis, the spinal stenosis will say it's 100 feet and that's it. And you cannot walk past that.
Okay, thank you. So this next question, probably for Dr. Castellani or Dr. Perry. My short-term memory is on the decline. It started when I was about age 50. Now I'm 62. Do you have any suggestions?
I can take that. First thing is look whether there's a history in the family. When you have an early onset change in cognition, that's something to be concerned whether there's a genetic contribution, such as ApoE, which would have an onset in that range. It also would be important to get memory screening to really define it. There are, and that's really critical to get, because defining whether it's Alzheimer's disease or other types of issues nutritional or psychological that are treatable is really important. And there are various things you can do, because the risk factor for Alzheimer's disease and heart disease are almost the same. So anything you do like exercise and lowering stress, which is beneficial for the heart, will be beneficial psychologically for changes of aging. But I recommend getting neuropsychological tests. There's foundations that do it for free. The Alzheimer Foundation of America does it, or go to a local neurologist and be screened.
Thanks. Dr. Castellani, do you want to add on to any of that?
Well, I mean, that's a common complaint in that age group. So, you know, it's something that doesn't necessarily portend a named condition. So we got to keep that in mind as well. People obviously are concerned about a major neurocognitive disorder when you talk about memory, but that's again, it's a very common accompaniment of age, irrespective of whatever name you want to give it. So, you know, a neuropsychologist could maybe sort it out and see whether this is just a age-related incidental issue that is within the spectrum of someone in that age group, or is it involving other domains, you know, such as speech or insight or things like that, which might be a little bit more sinister. But again, it's a very common complaint in that age group. So, you know, I would hesitate to relate that to anything related to occupational exposure, in my opinion.
So
it can happen to anybody.
Yeah, thanks, doctor. So I guess, you know, this same line of questioning, this comes in from a player. How do I know if I have Parkinson's disease, Dr. Castellani?
Well, again, so I'm a pathologist, so I don't diagnose clinical patients. I know a lot about what goes on in their brain, but Parkinson's disease has specific clinical signs. You know, one is called bradykinesia. You have slowness of movements. One is a tremor. You have a tremor of you shake in your extremities. You have rigidity. So if somebody pushes you, you might fall over a little bit more easily. So you know, Parkinson's disease. There is a period of time where people are early in the process and it's somewhat subtle. But once the symptoms develop, however, it's a fairly easy condition to diagnose by the neurologist, and you know there's treatment available for it. So the main thing is, you know, tremor, you know, slowness of movement, and rigidity are three main clinical signs for that. So watch out for that.
Okay, thank you. So here's an interesting question coming up, and you know, lots of our big guys that have played in the league, you know, this is a concern for them, you know, but I know this doesn't come without some risks. Is the gastric sleeve a good idea? And I don't know who can take that, you know, perhaps Dr. Masterson.
Thank you. I appreciate it. We started that program at our hospital. The gastric sleeve, as you know, is actually taking off the outside part of the stomach. We all kind of sat back, you know, I'm older. So maybe this is just no different than putting a balloon in there or something else. But they realized this cascade of hormones that were excreted by that side of the stomach, which antagonize mainly insulin and stuff, to the point where if you take those bad hormones out, you'll start to see changes in your in blood pressure and sugar, and a lot of other electrolytes within 2 to 3 days after the sleeve is done. At least in my little experience with it, maybe the last 5-6 years, it is amazing to watch. I mean, you can where people will get off their blood pressure medicine, get off their insulin, maybe not so much their cholesterol medicine, but the weight does come off. It does require work, so people can, as we say, eat through it and gain the weight back. But it's definitely a big help, and it's amazing when it works. You look at 120, 130 pounds in 6 months.
Great, thank you. So here's a question that came in through the chat. Many of us through the years have lived on ibuprofen. What are the negatives, and how can a blood test help alert alert me to if I'm doing any damage to myself?
I could take that one. So NSAIDs, while obviously highly efficacious as it relates to the anti-inflammatory properties, certainly have some counteractive cardiovascular negative side effects. And particularly if there are already cardiovascular risk factors present or disease. So if somebody has known coronary artery disease, they've had a heart attack in the past, they've had stents, if they have a known history of high blood pressure, particularly if we just talk about those who are stroke, then you really shouldn't be on regular NSAIDs. That should be really a contraindication. And I actually, that's been one of the questions we've posed that are quite interested in as it relates to the use of NSAIDs even in young football players. So we just published a study again, with the collegiate athletes that we have been investigating. They fill out questionnaires, so there's some limitations here, but we do some pretty intensive cardiovascular phenotyping. And what's interesting is maybe you would expect are the players that use the most NSAIDs are the ones that are already carrying some early risks. So these are the biggest players, your linemen, those who already have higher blood pressures that potentially are developing. And so the question of the use of that many NSAIDs early on, even later in life, is a very important active question. And we don't know the answer to that. I can tell you that there are some studies that have looked at retired players. These are colleagues of mine at the Cleveland Clinic, and they found that retired players have bigger aortas, much higher than you would expect. Again, these were compared to a control population, and we don't know why. We don't know if it's truly clinically significant, but clearly aortas that are measuring into an enlarged range. And so how much of that is related to some of the, again, the properties of blood pressure mixed with non-steroidal NSAIDs with vascular stiffening? It's an active, interesting question of mine. The answer of, is there a blood test? There is not a blood test that you can take to see if there's been a negative effect, but clearly if your doctor has already diagnosed you with high blood pressure, if you have underlying kidney dysfunction, again, if you've had a history of stroke or heart disease, there are other pain medicines that I would direct myself towards and stay away from non-steroidals.
Great, thank you.
Andre, just interruption. Pat Buttle, one of the Living Heart Foundation orthopedic rehabilitation, has come on board.
I think he's joined us, and he's just in time for this next question. Dr. Buttle joins us from there as well. So, for Dr. Buttle, I have a pinched nerve L4, L5, and numbness in my toes. What exercises can I do to reduce some of this pain?
Well, first of all, I would say hopefully he's being followed by a physician or at least a physical therapist, since he has already diagnosed L4, L5 disc herniation. That being said, there is a slew of lower back exercises as well as neck exercises, such as the McKenzie exercises that he can utilize. But I would also suggest, again, reviewing those exercises with the physical therapist prior to him doing those at home. In addition to that, he can also actively be treated with modalities such as heat, ice, TENS unit, electrical stim. But the main goal is to educate the patient on what he can do for himself when he's not in the mix with either the physical therapist or the physician. Obviously, I would say that if his symptoms increase at all during the course of his conditioning or stretching or exercise, obviously stop that exercise and follow up with his physician.
Great, thank you. Moving on, a little bit question that's not traditional medicine, but how can, how do we feel about cannabis for treating pain symptoms such as anxiety, stress, and sleep disorders? Who wants to take that? Anyone done any work in cannabis?
I think Dr. Roberts, you've been smoking that. No, just.
I've got my cigarettes behind me.
Does anyone want to expound on that? We're not working in alternative treatments.
On that one.
Yeah, I mean, I know the jury's still out on that, but our players, you know, certainly get approached often about some of these alternative type medicines. I'm just wondering if anyone's done any work or any research in those areas. If not, we can move on.
Actually, Dr. Kim had brought up his colleagues at the Cleveland Clinic. I think in last month's Cleveland Clinic Journal of Medicine, there was an article in there about cannabinoids and medical uses and stuff. But when you finish up the article, even his colleagues at the Cleveland Clinic were still scratching their head because no one's really sure how it works. You know, you might remember from, well, maybe not myself, but you know, the cannabis has changed since, you know, college days in the 70s to now, as far as its strength and possible toxicity. So I don't think medical science is there yet, and actually might even defer to the neuropathologist on the side if he's ever seen anything like that.
Yeah, I think. Thank you. So, go ahead, Dr. Perry.
Several papers in the Journal of Alzheimer's Disease regarding cannabis, both with regard to potential benefits for patients and the brain effects on imaging studies of the brain. And the most troubling one was the imaging effects on the brain, a study done of thousands of brains. And those people that had been frequent cannabis users had smaller hippocampuses, significantly, equivalent to like 2 or 3 years extra aging. So I think that the jury's still out about the benefit and the risks.
So thank you. So to answer the player's question, the jury is still out, and be cautious. There may be some hidden risks. Why hasn't the death rate decreased over the past 5 years for former NFL players? So the question is, and the player suggests that players are dying at somewhere between the ages of 30 and 35. And I know when we see news stories of a young former player passing away, the player community is all alarmed and they're thinking, hey, I may be next. But, you know, Dr. Roberts, maybe you can expound on this question.
Mortality in such a young group of football players is an uncommon finding. Several years ago, well, maybe longer than that, 10 years ago, Thomas Herron, who played in the NFL, either died on the football field or while he was jogging, preparing to play in a game. And there have been a few other young football players that have died at that early age. But I'd have to say it's got to be uncommon for a former NFL player in his 30s to die. And I can't, off the top of my head, remember anyone that's died that young, certainly in the last 5 years. So I don't think it's a big worry, but taking it on further, controlling the risk factors that Dr. Kim has talked about, Ray has talked about, that's the way they can prevent dying of at a young age, provided there's no genetic particular problem that predisposes him to have that. So I think weight management is a big factor. Cardiovascular risk factors are big. The way one adjusts to life after football. For some of the former NFL players, it's a dilemma. What do I do now with the rest of my life? I'm still a young man. And I think it's important, Andre, as you have done, and as the NFLPA has done, is trying to find out who are struggling with an identity after football, and working with them, whether it's with psychologists, general medical doctors, or just a friendly call. Brig Owens, who's with us today, and was a great NFL football player in his day, has reached out for years trying to identify players in need of help. And even just prior to this conference, Brig and I talked, and he's acutely aware, and I'll ask him to say a few words in a moment, of many of the players that would love to have a way to communicate about problems that of their health and of their lifestyle, and they would look to the NFLPA and Living Heart Foundation and any of the other doctors that we work with and hospitals that we work with to help them get better. Brig, your thoughts on that?
I think one of the big problems that players run into as soon as they retire, they've been under the watchful eye of the coach and the team doctor and so forth. And as soon as they retire, they take this big breath and said, I don't have to worry about my weight anymore. And all of a sudden they balloon up to 20, 30, 40 pounds within a very short period of time. I know when I retired, I went from 205 to 240. And I was having a hard time going upstairs. And I decided to lose that weight. My wife got me off of red meat. I haven't had red meat in 35 years. And I think it's very important for the retired players to learn more about their body and become very educated in terms of what the do's and don'ts. I think like Dave Gergen, he's dealing with sleep apnea. Guys got to understand, maybe they need to see someone with regard to sleep apnea. Dave, I think, you talked about one of the important things is very simple, is get oral hygiene. That has an impact on the heart. And, guys need to understand those kinds of things. And Dr. Kim, I think you know better than anybody in terms of the importance of good oral hygiene, flossing and those kinds of things. I've tried to keep up with some of this stuff, but there needs to be an educational system that these guys can go to. Maybe there needs to be some kind of outline or pamphlet that needs to be given to them as soon as they retire. These are things you need to look out for. These are the key doctors in your area.
Dave Gergen, do you have any comments? Thanks, Brig.
Let me incorporate a question for Dave, because one did come in related to sleep apnea. How do we get information on a sleep apnea test? Where do we go? How do we connect? And then Dave, you can kind of combine that together with the question that Brig is asking. And you guys are on mute, Dave.
Okay. Hi, guys. So yes, good question, Andre. In the past, if they need a sleep test, they feel like that the guy needs to get tested, he can either do it two ways. Usually they go through Living Heart Foundation, and then Archie will send over the request for the home sleep test, or they've been through the trust. We get them that way as well. Or they go to Pro Player Health Alliance online and reach out to me directly. So those are the three ways that the players get the test. The new test that we're going to be using is it fits on the finger. I mean, it's such an incredible little tool. It's right here, and thank you, Palmer. It's right here, and this just opens up. And Palmer, can you open this here? Open this. And Andre, it's so simple now. The new test, it just wraps around this. This is it, and it tapes onto the finger through tape. And overnight, they sleep with it on their finger, like so. And it's got 8 channels, and it's got amplifiers that listen to the heart. They can listen to the diaphragm and the breathing. It's absolutely incredible. and it's the latest technology. And you guys can go look online. It's called Night Owl, just Night Owl, just like, you know, night, Night, and then owl, like the bird. And it is so incredible, the results that we're getting on this. And we've done it now on 10 former players. And I'll be submitting the dashboard to Dr. Roberts and to Andre Collins to see what is happening to our guys and what is moving forward. And we are, honestly, I'm just so pleased with this, Andre. We're able to titrate the appliances even better now. Because of this COVID-19, I've been communicating directly with former players a lot more than I had in the past. And I'm talking to guys through how to adjust the appliances with this now Zoom calls. And you can see how clear this is. It's remarkable. So we're actually titrating the patients and getting incredible results. It's really a hands-on operation. We've also developed a impression material like this. Johnny, would you grab some of this? It's incredible. So this is the tray, and we have the tray available in 2 sizes for the NFL guys, medium and well, 3 trays, medium, large, and extra large. And this putty is a 2-part system. You mix it in a paste. You got 2 minutes to mix it and get it in here. And we got to demonstrate it. We have a demo video, Andre, that's on our website, Pro Player Health Alliance .com, Palmer, or .com.
But Dave, to make a long story shorter, you know, we can get to the players from anywhere in the country. So players are asking how to connect, and I say, you know, to everyone, just call the NFLPA main number, connect to the Professional Athletes Foundation. We can get you to some cardiovascular screening. We can get you to some sleep testing. We can get you to a hearing test. So connect through the Professional Athletes Foundation on that. But as we come down the home stretch, this is the last question in the question box. And I guess Dr. Masterson can take this. In the absence of the Living Heart Foundation screenings for now, could you provide a specific recommendations for a few exams that can be performed locally that we can come back and share later with Dr. Roberts, just so that we don't lose the continuity in our regular physical exam process?
The problem is with a physical exam, you need, to me at least, like the way I understand it, you're gonna need someone to do the exam. Self-exams are, you know, unless you can follow your blood pressure, follow your weight, keep an eye on your pulse rate, make sure that your endurance skills are maintained, stuff that you can measure yourself because no one else can measure them for you.
Yeah, I think, sorry if I didn't make the question clear. I think they're saying, you know, of course they trust Dr. Roberts and they would love to go see Dr. Roberts every year. But since they can't right now through this program, if they were able to get appointments with their personal doctors, what exams would you recommend that they request from their personal physicians?
I think if the personal physician was paying any attention and what did you do before you came here, even like Dr. Kim, I think would agree. And then you talk about these sudden cardiac deaths in 30-year-olds is, you know, obviously the blood work, an EKG, a 2D echo to check the chambers and the valve size, at least to start there to look for, you know, hypertension, diabetes, structural heart disease, and then judge their nutritional status. We go back into Alzheimer's disease and neuropathology, and I think more and more some of the simple stuff that you and I were taught as kids is starting to come back. Vitamin D, vitamin E. You and I are older. We don't get as much vitamin D as we should, but that may be a lot more as the nutritional part is just one part of staying healthy and trying not to get old too fast.
Yep. Thanks, doctor. So here's a little bit of a personal question, and I guess this is directed at the cardiologist and Dr. Roberts. I'm 48 years old. I went to the doctor because I was having some deep pain in my upper left chest wall over a couple of weeks that seemed to come and go, just under the left clavicle region. Also felt like the room was tilted, had a little bit of stomach pain. It's not triggered by any activity. It just seems to come and go. So he had an EKG done, and he's saying that he sent the EKG to Dr. Roberts' email. So, I just want to make sure, Dr. Roberts, that you see that and have a chance to follow up individually with this player. I'm taking a note of the player's name, and I'll reach out and we can connect after the call, but I just wanted him to rest assured that we see his question and we will work on connecting him to the right services.
Yes, Andre, as soon as we get this information, we'll take a look at it and we'll do what's necessary. But I think the way in which we may be able to, in a general way, help players that come up with a problem that they're concerned about kind of more acutely is you and I can figure out a hotline system where we can talk to that individual immediately and direct him through our connections all over the country to the right doctor.
Thanks, Archie. Well, folks, as we sign off, I think we're coming to the end of our hour. We're a little bit over, but as I sign off, the Professional Athletes Foundation just really wants to thank all of the doctors for taking their time today and answering some important questions for our player community. For the players out there on this call, there are vast resources between the NFLPA, the Professional Athletes Foundation, the NFL, the Players Trust powered by the NFLPA. Please connect. Just connect through the main number at the NFLPA and we'll get you to where you need to go. There's nothing that we can't do for you as a former player. So with that, that concludes this edition of the PAF Pep Talks, and we're signing off from Andre's basement here in Arlington, Virginia. Thanks for joining.
Thanks.
Great job, Andre.
Thanks for participating.
Thanks for putting it together.